I am Dr. Robin Adhikari. Today I will discuss about pathology. Pathology is an important subject in the field of medicine. The word pathology is consisted of two components of word. One is pathos, another one is logos. Both these words are of Greek origin. Here pathos means disease, logos means study. So, if we combine these two words, we will get study of disease. So, pathology is the study of disease in beef. What can be studied from pathology? Structural change, biochemical change, and functional changes. So, study of structural, biochemical, and functional changes in cellular, tissue, and organ level. In the very beginning of medical courses, three important subjects are taught. One is anatomy, another one is physiology, and third one is biochemistry. In short, biochemistry, anatomy, and physiology. These three subjects are the pre-clinical subjects, and these three subjects are taught in the first year of the medical courses. After the over of the first year, we have to study pathology. Here, pathology will teach us the alteration of the body, that is, the alteration of the biochemistry, also alteration of the anatomy, alteration of the physiology. So, pathology is the branch of medical science which deals with the structural, biochemical, and functional changes at the level of cell, tissue, and organ. So, three important key points in the definition are anatomical change or structural change, biochemical change, and the physiological change. So, structural, biochemical, and functional, three important points are to be remembered. So, study of structural, biochemical, and functional changes are taught in pathology. So, this is the important subjects which is to be learned very well to be expert in clinical subjects. So, other subjects are also there in medical sciences, and they have a relation also among themselves. Pathology is not an exception. It has a relation between preclinical subjects and clinical subjects. Preclinical subjects mean bug, which has already been taught or mentioned, and the clinical subjects means the subjects related to the disease aspects and its treatment aspects, especially the practice of medicine, surgery, gynecology, and like that. So, this BOB is known as the basic sciences, and the clinical medicines means the practice of medicine, surgery, gynecology, etc. In between these two, there is pathology. There comes the pathology. Pathology makes a bridge between preclinical subjects and clinical subjects. Preclinical subjects mean biochemistry, anatomy, physiology, and clinical subjects mean practice of medicine, surgery, gynecology. And here, pathology makes a bridge between these two sides. If we learn pathology very well, we will learn easily the clinical science. And to study pathology very well, we have to acquire knowledges of BAF, the basic sciences. So, this is the main thing. Pathology is a bridge between clinical and preclinical subjects. Come to the pathology again. What can be learned from the subject's pathology? Pathology is basically divided into two parts: general pathology and systemic pathology. The study of pathology in general the study of pathology system-wise. The system-wise study of pathology, study of pathology in general. These two things. In general pathology, we learn something which is related to the patient as a whole, a man as a whole, general aspects. And in systemic pathology, we will study the disease condition, the pathological condition of a system. So, in general pathology, what we learn? We learn the reaction of the cell and tissue stimuli or some inherited defect. There will be a reaction, cell tissue to inherited defect and some abnormal external stimuli. And in systemic pathology, alteration of specialized organ and tissue we will learn. So these three things, general pathology and systemic pathology. To be versed in systemic pathology, we have to learn the general pathology well. So one is related to another. And primarily very important is the general pathology. We have to know the general pathology very well. Then each and every component of this general pathology can be fitted to the system. So it will be the systemic pathology. We have to learn first the general pathology, then we will easily learn the systemic pathology. Another thing is very important. What will be the main aspects of the pathology, study of the pathology? Four important aspects are taught in the subject's pathology. What are they? They are etiology. Number 2 is pathogenesis. Number 3 is molecular and morphologic changes. Number 4 is clinical manifestation. Again, we will repeat. Etiology. Etiology means cause of the disease. If we know the cause, it will be very easy for us to treat the case. So, cause, it is discussed in pathology. And that cause, how produces diseases? How does a cause produce disease? Is to be known, and that is the pathogenesis, the mechanism of development of a disease. Pathogenesis. As a result of this mechanism, there will be some changes in the morphology of the cell and tissue and some molecular change, that is the subcellular changes, that is the biochemical changes. So that is to be studied also. And what will be the functional changes, that is the outwardly clinical manifestations, are to be learned also. The functional consequences of these changes. So etiology, mechanism of development of disease. As a result of this mechanism, there will be some cellular and subcellular changes, molecular changes and morphological changes. As a result of this type of changes, there will be some abnormal functions, that is the clinical manifestation, that is the signs and symptoms. How a signs and symptoms of a disease are produced can be learned from pathology. So very, very important this subject is. We have to study pathology very well to be expert in clinical medicines. So this is all about this discussion. Thank you.